Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas. In today's class I am going to discuss the MCQs related to embryology and histology of the neurosciences, that is block D. So here is your first MCQ. Select the layer of the cerebral cortex in which predominantly motor neurons are located. The different options are the molecular layer, the external granular layer, the external granular layer number 2, number 3, the internal granular layer number 4, and the internal pyramidal layer, that is layer 5. So here are the different cells, and here in this diagram you can see these are the large pyramidal cells which are the motor neurons which are present in the cerebral cortex, and these are present in the layer 5. So correct option is E. Next MCQ is select the layer of the cerebellum that contains Purkinje cells. It may be molecular layer, granular, white matter, folia, and medullary layer. So here is the diagram, and according to histology, the cerebellar cortex consists of 3 layers. This outer layer is the molecular layer, the middle is the Purkinje cell layer in which all the Purkinje cells are present, and inner is granular layer. This whole is the gray matter, and inner to this is the white matter. So Purkinje cells are located basically in the Purkinje cell layer, and this MCQ was taken from the professional exams of your university, and options, no one of the option is correct in this MCQ which is given in your university exam. Third MCQ is that select the histological feature which is characteristics of thoracic spinal cord. This is also very important. You can see over here in this diagram that the large ventral horns with extensive motor neuronal cell bodies. First option. Second is prominent central canal, surrounded by large amount of the white matter. Third is presence of distinct lateral horns containing autonomic neurons, and absence of dorsal column compared to the cervical section. Thick myelinated fibers in gray matter. So please remember that this is the thoracic spinal cord, and at the level of the thoracic spinal cord, the sympathetic parasympathetic system is present. The sympathetic system is present, and this sympathetic system, the neurons of sympathetic systems are forming the lateral horns. So distinct lateral horns are present at thoracic level of the spinal cord, and option C is correct. Another MCQ is histological section of the spinal cord was found and focused under the microscope. The following features were identifiable in histology. The H-shaped gray matter with prominent ventral horns. So select the part of the spinal cord. Very important. You can see over here, first very important thing you have to understand that the largest circumference of the spinal cord at all levels, it is present, the largest is present at cervical level. There are different reasons why it is largest. First, at the level of the cervical spinal cord, there is the origin of the brachial plexus. So because of the brachial plexus, the anterior horn is enlarged. Also important function is that at the level of the cervical spinal cord, all the descending fibers are present in white matter, and all ascending fibers are accumulated in the white matter in ascending tracts. So because of this, all the reason the ascending tracts are present, the descending tracts are present, and the anterior motor neurons are well developed. So the circumference of the spinal cord at cervical level is highest, is largest, and anterior horn, which contains the motor neurons for the brachial plexus, are more prominent at the cervical level. Next MCQ is what is most distinct histological feature of the parotid gland compared to the other salivary gland. So here is the slide. You can see predominant mucus acini, no, because the parotid is purely serous. Presence of numerous serous demilunes. Please remember, serous demilunes are present in such cases where the gland is of mixed type. So as parotid is a pure serous gland, so exclusively serous acini, this is the correct option. Next MCQ is 17-year-old boy has a fever and was given paracetamol tablet. Patient didn't take medicine because of bitter taste. So very simple question, which papilla on tongue detects the bitter taste? So this is circumvallate, filiform, foliate, fusiform, fungiform. So these are circumvallate or vallate papilla which are present on posterior part near the sulcus terminalis, and they can taste the bitter things. Another important MCQ, the type of the epithelium predominantly lining the dorsum of the tongue, particularly in areas covered by filiform papillae. So here you can see the filiform papillae, these are present and these are covered by the stratified squamous keratinized epithelium. So correct option is D, that is stratified squamous keratinized epithelium. Next is very simple question. Calcitonin is a hormone secreted by thyroid gland. So identify the type of the cells that produces calcitonin. Very simple. These are the parafollicular cells or C cells which produces calcitonin. Then select the structure which has many serous demyelin on histological section. This may be parotid, submandibular, pancreas, liver or spleen. So as I have told you also in the previous slide that parotid is purely serous, submandibular is mixed gland, and in case of the submandibular gland the serous demyelins are present above the mucus acini. So correct option is the B, that is submandibular gland. Next is select the structure in which stereocilia of the hair cells are embedded. So here you can see in this diagram that these are the hair cells, the inner hair cells of organ of Carti, in which the stereocilia are present, and these stereocilia are embedded in the tectorial membrane. Here you can see this is the basilar membrane and this one is the cochlear duct, the scala vestibuli and the scala tympani are present. So correct option is the tectorial membrane where the stereocilia are embedded. Another MCQ is regarding supporting cells of the nervous system, that is oligodendrocytes. So the predominant cell type in CNS gray matter, no, these are the glial cells. They are responsible for myelin production in peripheral nervous system, no, they are responsible for myelin production in central nervous system. They have their origin from the neural crest cells, no, the Schwann cell have their origin with the neural crest cell. So myelin sheaths are the cytoplasmic process of the oligodendrocytes. Yes, it is true, and responsible for formation of the blood-brain barrier. Again, wrong option because astrocytes are responsible for this function. So, correct option is D. Next MCQ is most inclusion of the neuronal cell cytoplasm is the crystalline inclusion granules, glycogen, lipid inclusion, lipofuscin and melanin. The correct option is lipofuscin, that is D option, because most of the cases neuronal cell cytoplasm contain lipofuscin. Another is the regarding myelination in the peripheral nervous system. The cytoplasm of the Schwann cell is not present at which of the following place? So here in this diagram you can see that this is the axon and these are the different layers of the Schwann cells, the sheet which is formed by the Schwann cell, and as a result of this Schwann cell cytoplasm is present in as inner color of the cytoplasm, as outer color of the cytoplasm, as the perinodal area and the Schmidt-Lenterman cleft which may be present in between these area. So the spaces where it is not present is the major dense line, because at major dense line the cytoplasmic membrane they combine, they fuses with each other and there is no cytoplasm at this space. Another important MCQ, the supporting cells of the ganglia in the peripheral nervous system is ependymal cells. These are present in the lining the ventricular system. The microglia, they are the phagocytic Schwann cells forming myelin sheath in peripheral nervous system. Stellate cells and satellites. Stellate cells are present in cerebral cortex and satellite cells are the type of the cells which are supporting cells of the neurons in the ganglia in peripheral nervous system. Next MCQ with related to spinal cord, which of the following is false about it? Anterior horn contains motor neuron. No, this is true. Then they have an intermediate horn in sacral region. So please remember that the thoracolumbar region is basically related to the autonomic nervous system, which have the lateral columns. So it is a lateral horn or intermediate horn. So intermediate horn usually present in the thoracolumbar region, not in the sacral region. This one is the false option. Gray matter is present in center, yes. Posterior horns contain sensory neurons, and white matter is present at periphery. So B option is correct. Regarding thyroid gland contains C cell and parafollicular cells. It develops from floor of the primitive esophagus. This is not esophagus, it is pharynx. One of the major exocrine, this is not exocrine, it is endocrine gland. T3 to T4 are liberated at the ratio of 20:1. This is opposite to original one. The deficiency in adults leads to cretinism. Now this is deficiency in newborn babies and in early childhood, which is cretinism. So correct option is contains C and parafollicular cells. Next MCQ is the ultrastructure studies of follicular cells of the thyroid reveals all of the following except. So look at this diagram first, that this is the ultrastructural level of the thyroid follicular cell. Here you can see its nucleus. These are the abundant lysosomes which are present over here. These are the tight apical junctional complexes which are present in it. The numerous rough endoplasmic reticulum in basal complexes and well developed supranuclear Golgi apparatus in the supranuclear region. So this is the lipofuscin droplets which are not present in the thyroid follicular cells, and this is the answer. Next MCQ is oral cavity is lined with the masticatory mucosa, the specialized and lining mucosa. So masticatory is found basically cheeks, floor of mouth, gingiva, inferior surface of tongue or soft palate. So this is basically present on gingiva. Next is in histological section, taste buds appear as oval pale staining bodies extending throughout thickness of epithelium. So principal cell types of the taste buds are all except. These are basal cells, neuroepithelial, neuroendocrine, supporting and stem cells. So please remember, neuroendocrine cells are present in GIT. They are not part of the taste bud. Next MCQ is only example of purely serous salivary gland is, that is parotid, palatine, sublingual, submandibular, von Ebner. So you must remember the parotid is the only example of purely serous salivary gland. Next is what are the conducting neurons in the retina. They are unipolar, they are pseudo-unipolar, they are bipolar, multi are uni and pseudo-unipolar. So please remember the true example of the bipolar neurons in the retina are these are the neurons. The bipolar are present in retina and these are the true bipolar. These are conducting neurons in retina. So option C is correct. The largest multipolar neurons, also known as Betz cells, are mainly present in which of the following layer of the cerebral cortex, that is molecular layer, the external pyramidal, the internal pyramidal, the multiform or internal granular. So we know that internal pyramidal layer is the layer number 5, which contains large multipolar motor neurons called Betz cells. So C is the correct option. During SGD session with second year MBBS regarding development of the spinal cord in newborn babies, the dural sac lies at the level of the which vertebra? So it may be number 4, 5, S1, 2, 3. So correct option is S3 because at the birth it is present at the level of the sacral vertebra 3. Next is flexures that develop between metencephalon and myelencephalon are the cervical, the cephalic flexure, the cerebellar flexure, the mesencephalic and the pontine. So here is the diagram, and in this diagram you can see the myelencephalon and metencephalon, and the flexure which is present in between these two is the pontine flexure. So this is the correct option. During STD session, the facilitator asked the student of his batch that at 24 week of development, lower end of spinal cord lies at which of the following level. So here in this diagram you can see the different levels of the diagram. This is initially, this one is at 24 week, then birth and in adults. So different levels. So at 24 week it is usually present at the level of the L4 vertebra. So Professor of Anatomy asked the student of second year MBBS at end of LGF regarding development of the spinal cord, that at time of birth lower end of the spinal cord lies at which of the following levels. So please remember, this is at the level of the L3. At birth it is present at the level of the L3, and at 24 week it is present at the level of the sacral vertebrae. Next MCQ is unipolar neurons are most likely found in basal ganglia, in cerebellum, in cerebrum, in dorsal root ganglia or spinal cord. So correct option is dorsal root ganglia, because unipolar, they are not actually the unipolar, they are called the pseudo-unipolar neurons. They are the sensory neurons. Their cell bodies are located in dorsal root ganglia, and they have one process which then divide into a T-shaped manner. One is peripheral and other is central, going to the central nervous system. So correct option is D. The central canal of spinal cord is lined with which of the following type of epithelium? So we all know that the central canal is lined by the simple cuboidal to simple columnar epithelium with cilia, and this is the correct option. These are ependymal cells which are lining the central canal. Next MCQ is that regarding development of the cerebellum, it is developed from which of the following brain vesicles? So there are the different vesicles. We know this is the telencephalon, from which the cerebral cortex is forming, the diencephalon, then the mesencephalon from which the midbrain, then the metencephalon and the myelencephalon. So metencephalon is forming the cerebellum and myelencephalon will form the medulla. So correct option in this case, that the cerebellum is derived from metencephalon. In development of the brain, which of the following condition results from failure of anterior neuropore to close? So as we all know that when anterior neuropore do not closes, there is exposure of the brain tissue to the corrosive effects of the amniotic fluid, and it leads to anencephaly. So option B is correct. The typical pharyngeal arch contains following component except. This is very important question and usually present in university exam. So must memorize the artery, the nerve, the cartilage and muscular component. They all are part of the typical pharyngeal arch except the vein, which is not present. Then the pharyngeal arch contribute to formation of what? Spinal cord, the brain, the meninges, the neck and the cranial nerve. So we all know that the pharyngeal arches contribute to formation of the neck. The stylohyoid ligament is derived from, this is also very simple question, it is derived from the second pharyngeal arch. So correct option is A. Then the hyoid bone developed from cartilages of the first and the second, the first and third, the second and third and fourth and sixth. So hyoid bone basically developed from the second and third. Its greater horn from the third arch and its body and lesser horn from the second arch. Which of the following pair is incorrect? Sixth pouch and superior parathyroid. So this is here we are looking for the correct answer. So this is incorrect because superior parathyroid is derived from fourth pharyngeal arch. Then third pouch and inferior parathyroid, this is correct option. Then sixth arch and superior laryngeal nerve, this is the recurrent laryngeal nerve, not the superior. Second arch and greater carnu of the hyoid bone, the second arch is forming the lesser carnu, not the greater carnu. The third pouch and palatine tonsils, so palatine tonsils are derived from the second pouch. So correct option over here is third pouch and inferior parathyroid. Next MCQ is endoderm of third pouch give rise to the epithelial reticulum of the thymus, capsule and septa, lymphocyte, all of above, none of above. So correct option is epithelial reticulum of the thymus is derived from endoderm of third pouch. Next is brachial cysts are the remnant of the cervical sinus and second pharyngeal grooves present along ramus of the mandible. So please remember their brachial cysts are remnants of the cervical sinus and second pharyngeal groove. They are not present at ramus but they are present just anterior to sternocleidomastoid, and then they are not remnants of second pharyngeal, rather they are remnant of second, not sixth but second. They are present just above the clavicle. No, they are present superior to clavicle and visible just after birth. This is also wrong because because usually they are present at early childhood or at puberty. So option A is correct. Excuse me. The tongue develops from combination of median and lateral lingual swelling, the copula and hypoglossal swelling, the median lingual swelling and copula, the lateral lingual swelling, the hypopharyngeal eminence and median lingual. So please remember the median and the two lateral lingual swelling, they are forming the anterior two-third of the tongue. The hypopharyngeal eminence contributes to posterior part of the tongue but not the copula. So where the copula is present, it has almost no contribution to formation of tongue. So wherever it is present, that option is incorrect. So the correct option is the median and the lateral lingual swelling. Nasal placodes are primordia of what? So nasal placodes are basically formed from the nasal epithelium. This nasal epithelium later on formed the nasal pits from which the different structures are formed. The nasal cartilages and nasal bone, they are derived from neural crest cells. Nasal prominence are actually the frontal prominence which are not derived from the nasal placodes. So correct option is the nasal epithelium. Then medial nasal prominence forms the philtrum, the intermaxillary segment, the primary palate, the premaxillary part of the maxilla. So these all are the correct option. Technically, the philtrum is also formed from the medial nasal prominence. Intermaxillary segment is also formed by fusion of the medial nasal prominence. Similarly, the primary palate, and these are all collectively called the premaxillary part. So all of above and option E is correct. Another MCQ is unilateral cleft of upper lip result from. So this is cleft of the upper lip. Failure of union of maxillary prominence with merged medial nasal prominence. Yes. Failure of union of maxillary prominence with lateral do not lead to unilateral cleft lip. The failure of union of medial nasal prominence, when they will not meet the maxillary, it will lead to the cleft palate. So answer A is correct option. And here I complete my today's class. Very best of luck for your exam and Allah Hafiz till the next class.